Make sure to like and subscribe and hit the notification bell to receive helpful tips on how to relieve pain. If you have any questions, put it in the comment section down below. Hello everyone, welcome. This is Dr. Jacobs. In this video, I'm gonna go over how to stop cervical radiculopathy pain at home. But before I do that, I'm gonna go over basic anatomy. We'll go over the symptoms, the causes, the risk factors, so it will make a lot of sense what you should do at home to stop or relieve cervical radiculopathy pain. What is cervical radiculopathy? It's basically something like inflammation or damage to the tissue, like the disc or degeneration in vertebra that pushing on the nerve root. And when that happens, that will cause pain, weaknesses, decreased sensation, or numbness and tingling in the arm. So as you can see here in the neck, when you start to have cervical radiculopathy, and that shows you in the red that something compressing on the nerve, it's like you have like a wire that going down and you suffocate that wire, or you cut that wire, that decreasing the conductivity of the nerve tissue, so you will have some weaknesses, decreased sensation, or numbness and tingling. So symptoms of cervical radiculopathy could be numbness or tingling throughout your arm or certain areas in your hand or arm or forearm. Also, you might feel like weaknesses in your hand grab, or weaknesses in your wrist or elbow. Also, you might have some decreased sensation, you lose your feelings, and you can see here in this image the distribution of the cervical nerve, and each one of those C is responsible to part of the nerve that coming from the neck. As you can see in the back of the hand and the front, it's usually that's the back of the hand, the posterior view here, and this is the front view that shows you the distribution of the nerve. And if you have pressure on any of these, you're gonna have symptoms that's responding to the distribution of that nerve. What are the possible causes and risk factors for cervical radiculopathy? One of the common causes is degenerative disc disease, and that's basic arthritis or degeneration in the joint itself. So you can see in this image the degenerative disc disease. As you see on the left side here, normal disc, normal vertebrae, and there is no degeneration. And when you look at the degeneration here, it's like a wear and tear in the vertebrae. When that happens, it causes more compression on the disc, which is in between here. And when that happens, that could push the disc into the nerve root and cause the radiculopathy. Or you might have the degeneration here, that's actually the degeneration itself of the vertebra that causing the pressure on the nerve. So that is degenerative disc disease. And when we look at this image, the top view for the disc should be nice and smooth like this, nothing protruding, nothing pushing. Because if we don't have a lot of room, this is really, it's actually millimeter of space. So it's not a lot of space to have degeneration or herniated disc. And that's actually the second cause, herniated disc. And you can see here in this image, when you don't have herniated disc, everything look nice and smooth here. And when you start to have herniated disc, that's pushing on nerve ending and cause radiculopathy. So, and you can see it from the side view here, it's pushing on the nerve. In the model here, this is the herniated disc, and this is the lumbar spine. So we are actually at the same anatomy of herniated disc happen in the cervical spine. The skull is here, and it happened here in the lumbar spine. But I'm gonna show you here in the model in the lumbar spine, because that's what they have it here. They don't have it on the top here. So when you have herniated disc, that herniation, the red part of the disc, so the disc is white here, should be like transparent in the color in the model here. So when that herniation pushing on the nerve coming down to your arm, technically not your leg in here. So when the pressure happen, that cause compression on the nerve, so it affecting the nerve conductivity and cause the radiculopathy symptoms. The other causes and risk factor, whiplash. If you have a motor accident and you had like hit your head or your neck. Also, if you maintaining poor posture, poor body mechanic for a very long time, like slouching forward in the front of computer or the TV or in your phone, and that will cause wear and tear in your joint and cause degeneration and could compress on your cervical nerve, and that will cause radiculopathy. As you can see it here, it's very obvious when we have neutral position like this person, the first one. The weight of your head is about 10 to 12 pounds. When you slouch forward, like in the image, in the last image here, in the front of your phone, and your head weight around 60 pounds. Just imagine you're doing that for like 6 hours, 5 hours, or even 4 hours a day. 60 pounds, your vertebra not built to lift that heavy weight. When that happens, that's a wear and tear in your vertebrae and your disc. That's shows you the importance of maintaining proper posture, and that's a very, very common risk factors to cause degenerative disc disease and actually cause herniated disc. So if you have the radiculopathy and you did not have the car accident or trauma, there's a very high chance you had it from poor posture, poor body mechanic that cause degeneration in the joint. So the other risk factor is osteoarthritis, which is wear and wear in the joint, or rheumatoid arthritis. So what should we do to treat or stop cervical radiculopathy? To answer this question, it's very important to understand the normal healing cycle, because when we understand normal healing cycle, it will make a lot of sense how to get to the root cause of the problem, and then we're gonna navigate some of the current treatment that doesn't work based on the normal healing cycle. So I'm gonna use external paper cut for visualization, but the same process happened internally from accident, trauma, poor posture, whiplash, degenerative disc disease, herniated disc. Your body has to go through those 3 stages in order to heal. So first stage is inflammation, swelling, redness. The blood start to rush to that area, and you can see it here. You cannot see it internally because the skin cover it. The second stage of healing is called the proliferation stage. That's when your body starts to build a scar tissue. During this stage, there's a cascade of events: fascia restrictions, muscle spasm, trigger points. I'm just going to focus on the scar tissue for the sake of our time, but the same process happened internally that cause restriction because of the proliferation cascade of event. So why scar tissue is important? If your body does not build a scar tissue, it's going to be open wound, susceptible for infection. So actually scar tissue very essential for our survival. We need that. We don't need too much of the scar tissue, especially in your vertebrae here that you really have few millimeters to space, that you really don't need any extra inflammation or scarring here, something pushing here, degeneration here, that will cause the radiculopathy. So this is very tiny space to tolerate any inflammation or scarring or fascia restriction that causing the vertebra to be compressing on the nerve. So perfect scenario, during the maturation stage, the body should clear up everything in the proliferation stage, the scar tissue, the fascia restriction, the trigger point, and clear up the inflammation. So if you have chronic cervical radiculopathy, that could be a sign you have inflammation and proliferation, and your body going that vicious cycle of inflammation and proliferation. So what should we do at home? I'm gonna go over some of the treatment that's not effective so you don't have to waste your time on it. And we're gonna relate that to the normal healing cycle, so it will make sense why these treatment does not work. And actually there's a ton of study shows these treatment provide either short-term pain reduction or nothing, no pain reduction. One of the common things that you use in a lot of clinics, heat, steam, or ice, and based on the study provide temporary pain relief, but when we look at the normal healing cycle, it's not going to do much to proliferation. It's not going to break your scar tissue, fascia restriction, release anything here, and it's barely temporarily going to do anything for inflammation. The other thing that you use commonly, foam roller and massage, and if you have inflamed area and you massage it or you use the foam roller, you're going to inflame it more. So and several studies shows it's either provide temporary pain relief or no pain relief. And when we go over the anatomy of the fascia system and the scar tissue, it will make a lot of sense why foam roller and massage are not effective, because you cannot exert mechanical force on a restricted area with the foam roller or the massage. The other thing that's commonly used is stretching, and I personally tell my patient avoid stretching by all means. Based on the study, stretches actually cause more inflammation, and when it cause more inflammation, that's going to cause more scar tissue, more fascia restriction, and will get you more in aggravating your symptoms. And I personally don't recommend it to my patient. And based on the study, it either provide temporary pain relief or nothing. So the other thing that commonly use joint mobilization, and it's been used by chiropractor, physical therapists, occupational therapists, and some people call it joint adjustment. And based on the studies, it provides either short-term pain reduction or no pain reduction. But when we look at the anatomy of the healing cycle, a lot of the issue we have is inflammation and fibrosis, scar tissue, fascia restriction, muscle spasm. When you have joint mobilization, it's basically moving the joint. If you have herniation, that possibly actually could push the disc into the nerve more and actually make it worse. So I will be very careful with joint mobilization or adjustment, because you don't want to move a joint that already inflamed to keep rubbing it, that will make it more inflamed, or may do joint mobilization on a joint that actually has herniated disc, so you can herniate it more. So I will be very careful about that. So the other thing that's been used is strengthening exercises. The problem with that, if you introduce it in an inflamed area, it's going to inflame it more. But strengthening exercise is not going to do anything to the fascia restriction, the muscle spasm, the trigger point, and anything here in the proliferation stage. We introduce the strength exercises, but I don't like to do strength exercise. I prefer to do function training, teaching how to perform proper posture. But we cannot do that while you have restriction in your neck or your fascia or muscle in the neck that cause you to have those poor posture. So we have to release all the tightness, release the fascia restriction, the scar tissue, decrease the inflammation, and then introducing the posture training and proper body mechanic. So how to treat it? So we have to look at the body from two aspects, the inflammation stage and proliferation stage. So if your radiculopathy related to herniated disc, degenerative disc disease, we have to be aggressively work on the inflammation, because it's very common with this condition. There's a lot of inflammation internally that cause the compression on the nerve. What to do for inflammation? First, you need to rest to avoid the motion that's aggravated. If you slouch forward, you need to really correct your posture, or sitting in the front of a computer or driving while you're leaning forward, we need to correct that so it does not aggravate it. The other thing I personally use is the MagnaHeal 2, and that is a very strong magnet, so it can penetrate the body 3 inches, and that's what I personally use for the herniated disc or the degenerative disc disease, because we want to decrease the internal inflammation in the disc, so that compression on the nerve will decrease while we're working on releasing all the tightness that caused by the proliferation stage with the scar tissue, fascia restrictions, and trigger points. The other thing that I put all my patients on an anti-inflammatory diet because I want to make sure they're not eating food that actually cause more inflammation. So for really severe cases, especially with rheumatoid arthritis or someone body not healing fast, there is a possibility there's a vitamins mineral deficiency that could cause the slowing of the speed of the healing cycle and make your body stuck between inflammation and proliferation stage, going back and forth. One of the things you can do right now is go to askastr.com, and the software, it's a free medical online evaluation that will help you and guide you through the possibility of vitamins, mineral, or hormonal imbalance that could interfere with your normal healing. So it's free, it takes about 5 minutes, and the result usually comes immediately. So what should we do for the proliferation stage? So we need to work on inflammation, at the same time work on the proliferation. So the proliferation stage, we have to break the scar tissue. As I mentioned to you, any injury, you're going to build the scar tissue and fascia restrictions. And that's exactly happened internally. When you look here, that is the degeneration here, that's a scarring, that's a calcification here. And that's usually start with fibrosis in the vertebra. And when that happens, you start to have inflammation and the disc start to bulging on the nerve. So what we can do is we can work on breaking the scar tissue externally, which actually pushing your vertebra internally, that causing more pressure on the nerve. So how to do that? What I personally use the A3 tool to break the superficial scar tissue and release it in the neck area, that actually those soft tissue in the muscle and the tendon that compressing on the vertebrae. So I release all the tightness, all the adhesion externally, and then I use the A5 to break deep scar tissue and deep adhesion to make sure there is nothing pushing the vertebra internally. And when I do that, I have to really work on proper posture and proper body mechanic. So the other thing we have to work on is the fascia system. Briefly, I'm gonna explain the fascia system here because this is very important part of the treatment for cervical radiculopathy, and one of the things that's overlooked by a lot of healthcare providers. And you will understand how crucial the fascia system when we understand the anatomy of the fascia system. So fascia system, you can see the fascia layers here. It's like the white tissue here, and in the cadavers, it's very thin layer that trapping the entire body. This is the superficial fascia layer. We have several layers. We have layer that trapping the entire body. It's called the superficial fascia layer, and then we have layers that trapping each individual muscle fiber and a group of muscles. So the second category of the fascia is a deep layer. The deep layer is divided to 4 subcategories. As you can see it here, the first one is the aparatic fascia. Aparatic fascia wrapping a group of muscles. Then you have the epimysin that wrapping each individual muscle. Then the premiysin wrapping each group of bundle of fibers, and the endomysin. To make things more complicated, but don't worry, the treatment very simple. Each of these layers, the aparatic fascia, epimysin, premiysin, endomysin, and superficial layer, has 2 to 3 subcategories of fascia layers. So when we look here, you can see here the epimysin wrapping each individual muscle fiber here. Then you have the premiysin that wrapping a group of muscle fibers, those individual bundles. And then at the end you have the endomysin that wrapping each individual muscle fiber. So that's why I said foam roller and massage impossible to release all, to cause a good physiological change to break scar tissue or release fascia restriction, because it's impossible with the hand or a foam roller just rubbing on the skin to go deep enough to really do deep release. And that's why I use the A5 to release the epimycin, premiycin, and endomycin, and I use the A3 tool to release the superficial fascia layer and the apratic fascia layer. So what should you do at home? We have to work first on releasing all the tightness. So I release the superficial fascia restriction, the deep fascia restriction, release the scar tissue, the trigger point with the tools. And then after that, if you can tolerate and if you have a lot of inflammation, I usually start with the Magna Heal to decrease the internal inflammation. So this way, when I use the tool, it will be easy for the patient to tolerate. While I'm doing that, I start to educate the patient to perform proper posture, proper body mechanic. Because if the patient felt the relief and the tightness and the decrease of the symptoms from releasing all the restrictions in the neck area, but went back to the poor posture, poor body mechanic that they have, that will actually cause more inflammation, more scar tissue. So immediately after the treatment, we have to correct the posture. We have to correct the anatomy of the neck by avoiding the slouching forward. It's very typical that patient can correct their posture easily when we release all the tightness. When we don't release the tightness, patient will not be able to maintain proper posture for a very long time, because they're gonna feel like the tightness and the scar tissue that pushing them down, it feel like it's to straighten up, it feel like lifting 20 pounds or so. So that's conclude how to stop or relieve cervical radiculopathy pain. If you have any question, leave it in the comment section below and I will answer it in a future video. We'll see you soon. Make sure to like and subscribe and hit the notification bell to receive helpful tips on how to relieve pain. If you have any questions, put it in the comment section down below or go to asterinstitute.com.